Good morning, everybody. Welcome back. We love to feature Iowa Veterinary Specialties here on a regular basis and all the great work that they do for our pets. And here today we have Dr. Shauna Green. She's joining us. We've been talking we've been focusing on the oncology department that
Correct.
you guys have over there. And I know you have some great information today in regards to just the warning signs
Correct.
for pets with cancer.
Absolutely. Just like in people, there are certain things that you can look for. They don't always mean that cancer is present, but they're a good kind of rule of thumb, things that you can check for on a regular basis that may say, hey, I need to get this checked out with my veterinarian just to make sure that this isn't something more serious, because again, just like with people, the earlier you can detect cancer, the better their outlook is. So things that we would watch for would be if your dog has a lump or a bump. That's a big one. A lot of times they're just benign fatty masses, but they can be more serious, and they can have been there for many, many weeks or even months and still be something more concerning.
Is there a certain look to these bumps? Because I have an older dog, and
Yeah.
we're living the life of lumps and bumps.
Absolutely.
And
again,
we go in and get them checked, and they're always
Sure.
benign, which is a great thing. But sometimes they're starting, they don't always look the same.
Exactly.
So is there something in particular that we should look out for?
You brought up a really great point, because sometimes things can change. And so if you have a lump that changes from being very soft and squishy to being more hard and firm,
Yeah.
say it had hair on it and then it doesn't,
Right.
or again, if it has a color change or a big change in size over a short period of time, those are definitely bigger red flags than, again, it's just a nice soft lump that's been there for quite a while.
Quite a while.
Is it something that, do you recommend, because I know we had one and we had it removed and
Yep.
it wasn't an issue, but do you recommend getting them removed, just kind of keeping an eye on them, or does it maybe
what I would
just
recommend is the first thing that we do is we make what's called a body map. So we basically go over with a fine tooth comb, we run our hands over, we have 3 or 4 different people do it, find any lumps or bumps and measure them. So that way we have a baseline of exactly how big they are. And that's something that you can do at home as well. We try to do 3 dimensions, kind of length, height, and width. That way, again, it can change in one of those dimensions, and that can be something that's harder to tell. And then the next thing we do is do a fine needle aspirate. So we take a very small needle, just like we would use to take blood from a person or a pet, and we stick that needle in and we aspirate out some cells. And that's a really good screening tool, because although there's a little pinch, it's not super painful. A pet doesn't need to be sedated for that. And if you get just fatty material, then you know it's benign, versus if you get something more serious like blood, then we need to look at that under the microscope and make sure that there's no abnormal cells there. So that way we don't need to just rush right into removing it. We know whether it's serious or not.
I always say it's a great excuse to pay attention to our pets and pet them
Exactly,
often,
exactly.
so you know what's going on. My boyfriend is like, what's this? What, I've never seen this before. I'm like, that's been there for a long time, dear. Don't worry.
Exactly. And
about
I have
it.
people that bring their pets in and they're like, oh, my dog has a new lump, and we pull up and we're like, oh, nope, this has been there before.
For a while.
Exactly.
Okay, so I like that idea of doing a chart. What are some other warning signs?
Yeah, so things that you would watch for at home would be, again, not eating well, losing weight, and this is over, a period of time,
Right.
or a short amount of time as well. Trouble going to the bathroom. Again, if you see your pet out in the yard straining, it could be something simple, just like a urinary tract infection, but it could indicate something more alarming is going on. If they have any abnormal odor to them, it sounds kind of strange, and pets kind of have their own smell, but if you smell something different, that could be a sign to check something out. If you notice any changes like bruising or blood coming from anywhere, whether it's a mass or from the mouth, those are good indications that we need to investigate further.
And you also listed like wounds
Exactly.
that aren't healing very
Exactly.
well properly.
Okay, so all important things if you're kind of being aware of your friend, to make sure that if something's happening, you want to take them in sooner or later.
Absolutely.
Don't wait to see if
the
things are going to
the
change.
sooner you get it checked out, the better. And the same is true for people too.
Absolutely. Kind of
And a lot of these things we're looking for are same with us.
Absolutely.
So.
All right, think about that. Okay, so let's talk about, in case you do get the diagnosis, that it is cancer. What does that mean, and what's kind of the outlook? I know it's a little bit different for everyone, but what do you recommend?
So when people come in to see me, the first conversation we have is what type of cancer do they have? What are the options that we have available to try and treat it? And then, we focus on our pet's quality of life.
Yes.
So obviously there are things that can be done, but maybe they shouldn't always be done. And that's where we kind of have to lay out all the different options that are available, and we make that work for that individual pet and that individual family. Unfortunately, what may be right for one family isn't right for another based on their circumstances. And so we, again, want to make sure sure that that pet has the best quality of life possible. And that's where it can become kind of hard to assess sometimes. You're emotionally invested, you're with these pets all day long, every single day. And so there's a lot of great resources out there, some different quality of life assessments that we can put into action, because when you're going through this process, it's very scary, it's very overwhelming, and you kind of sometimes lose focus. And so that's where it's really helpful to have this kind of scale that you can refer back to and say, hey, you know, my dog used to meet me at the door every single day, and now they're just laying on the couch. Or my dog used to eat his food no matter what I put out for him, and now I have to make him a steak every night for dinner just to get him to eat. And so those are all factors that we take into consideration, and we want to make sure that, again, whatever we're doing for a pet, we're doing for them, and not necessarily for us.
I'm glad you brought that up, and we're showing you a scale right now that will kind of break down for you, which includes a bunch of H's and a couple of M's, because a lot of times, I know this for me personally, you're so close,
exactly.
And you're like, no, they're fine. Yeah. I don't care. I'll wake up every couple of hours because they need to go outside, or they need to be carried everywhere, when reality needs to be sunk in a little bit, so for their quality of life. So let's go a couple of the entities that we should really look at with that scale.
Yeah, so basically, you know, again, it can be different for everyone, but what I usually tell owners is that, you know, is your pet readily eating for you? Because if they're not eating, you know, if you have a lab that is going to eat a drop of food until you're till the very end, that's one thing. But a lot of dogs, again, that's a big sign that they're not feeling well, they're uncomfortable, that there's something significantly wrong. So hunger is a big thing. You know, are they happy? Again, are they meeting you at the door? Are they wagging their tail? Are they doing everything that they normally would have done before their diagnosis or their whatever illness they're dealing with? And so again, just those little personality things that maybe you would notice, but your neighbor may not have an idea about. So that's a big one too.
The two big for me when I finally had to decide it was time was the two M's that are on this scale, mobility, and let's look at those days and start marking, are there more good days or bad days?
Yeah, and I think it is really good to keep kind of a calendar and just, you know, you can do whatever system you like, but put a plus down. You know, if we're having a great day, a couple pluses. If we're not having a good day, maybe one plus. You know, and that way you can really look back over the last several weeks and say, gosh, there's less pluses here than what I remember in my mind, because it's our nature to remember all the positive things and kind of block out the negative. You know, and again, mobility is a huge thing too. You know, it's different if you have a 5-pound cute little puppy you can carry around everywhere, but when you have a 100-pound lab that can't use its back legs, that is huge. You know, they can't get up, they can't go outside, they can't go to the bathroom. That's a huge thing for quality of life. And so that's something that we definitely take into consideration significantly.
Yeah, let's talk about that for a minute, because the treatments for cancer with our pets is different than because we're trying to cure it when it's with us.
You're absolutely right. So I would love to cure every single patient that walks into my exam room, and I try that. I you know, give owners their realistic expectations. You know, there are certain cancers that are very common in dogs, like lymphoma, that is very, very treatable. We are able to get that cancer into remission, but unfortunately, at this point in time, there is no cure. So I don't want them to leave thinking, well, gosh, there's no hope, because there's definitely hope. I can make your pet feel better for years, but unfortunately, I can't make this cancer go away. And that's where, again, we talk about, you know, essentially, you know, these are the treatments. Our goal with these treatments is to get your pet better. Our goal would also be not to have there be any side effects. So when we give pets things like chemotherapy, I don't want them to get sick. I don't want them to lose their hair. I don't want them to have the terrible side effects that sometimes people experience. I want them to feel good. My hope would be that there would be zero side effects at all, but sometimes that isn't the case. But if there are side effects, we try to make them as minimal as possible. So maybe a day or two of a little bit of tummy upset or loose stool, or maybe just not eating a full meal. But hopefully out of 7 days a week, we see less than 1 day of them not feeling good. And that's where, again, it varies quite a bit from people, because, again, humans can understand that we want to cure your cancer, and we'll do whatever it takes to get you there, almost unfortunately pushing you too far. And that's where in pets it's a whole different ballgame, because number one, I am not in the business of making pets sick. I want to make them better. I want to get them through this and see the other side where they're feeling good and you know, having a great quality of life.
Yeah, just an example of the amazing doctors and specialists that are part of Iowa Veterinary Specialties. So we encourage you to check them out. Also 24/7 emergency clinic. They are there for you if you have any questions or concerns, or have more details that you would like to know about quality of life and kind of checking out that scale system. So how can they reach out and learn more?
Yeah, so basically you can definitely give us a call anytime. We're at 515-280-3100. Also, we're over off Crescent Avenue by Valley Junction, and you can definitely check out our website, ivsdsm.com.
All right.
Thank you. Keep
Always
up the great
great
work
to talk
over there.
Thank you guys for having me.
Good information today.